Hello and welcome to today's webinar. Thank you guys for all registering and jumping in the room to be a part of us. Today's webinar is called Medicare 101. And so we appreciate you all. As you can see, ELGA Credit Union is remaining committed to supporting and preparing our members with retirement education. This is our third webinar if you've been with us each time. And we get very excited about educating you all. And so as we get started, just a couple of brief household items, right? The first of which is, please, if you can, take a moment to fill out the short poll that's showing up on your screen while we wait for other members to join us, as we're going to have more friends get into the room. But if you've got time, just go ahead and jump in there, take care of that short poll so we can gather some information from you. It's important to note that we are going to have a question and answer session during the end, but there is a Q&A feature right at the bottom of your screen. And so if you have some questions that you want to make sure that we get, we're going to keep an eye on that throughout the webinar. And as I stated, we're going to have a live Q&A at the end so that you can submit your questions at any time during the presentation. Okay. Last thing is, I want to make sure you guys know, for me, is that we have a new free tool that's going to be available exclusively to ELGA Credit Union members to support you on your retirement journey. And we're going to talk about that throughout the session. But if you'd like to explore it yourself, right, you can scan the QR code on the screen, or you can visit elgacu.silvur, that's SILVUR.com, to create your own profile. So there is an excellent tool that's going to just help you on that journey that's exclusive for our members. And but without further ado, because I am not the speaker of the hour, right? We have someone that knows so much about what it is that we're going to be talking about regarding Medicare today. And so I want to share with you guys that Jessie Palmer, who's going to be our Medicare expert today. Jessie leads Silvur Insurance Services with a heart for service and a gift for simplifying Medicare. She makes it very understandable. She is a top producer turned trusted insurance expert. Jessie brings warmth, clarity, and years of industry excellence to help families confidentially navigate their retirement journey. And so without further ado, allow me to introduce Miss Jessie Palmer that's going to teach us today. Welcome, Jessie.
Oh, absolutely. Thank you so much for having me today. As you mentioned, I am Jessie Palmer. I am actually local to ELGA Credit Union. I live in New Lothrop, Michigan, so I'm not someone who's halfway across the country trying to help you as you answer all of your Medicare questions today. I've been in the industry for a long time. I've written thousands of Medicare policies and helping members navigate through those journeys. I am today joined by Stephanie Luck. Steph is going to be helping me as we go through today. She's going to be taking care of all of those questions that all of you have. I do want to make sure that everyone knows there is a Q&A box at the bottom of your screen. As you have questions during today's presentation, and I'll be very disappointed if you don't, then do drop all of those Q&As in that little box, and we'll answer all of those at the end. And she's going to be keeping track of that. There is also just a disclaimer to that. We do want to make sure that as we're answering these questions, we are protecting your private information. So do keep your questions general in that chat, just because all of these will be disseminated to all the members. We want to make sure that we're protecting your specific privacy. Let me go ahead and share my screen here. Today, we're going to be talking about Medicare 101. We're going to get back to the basics and talk about just really what is it and what do you need, when do you need it, all of those kinds of things. And this is a great resource that ELGA has provided to you at absolutely no cost. Kevin had talked about a QR code. You'll see that at the bottom of your screen. That will actually take you to some additional resources that you can use after today's webinar. You don't have to do it right now. You can do it later on. I do also want to remind you that today's webinar is being recorded. So those of you who are note takers, you can actually sit back and relax. The entire webinar today will be provided to you after we're done, and it takes about a day. And ELGA will be providing that to you as we go. Okay, so now when you take that, use that QR code, it will take you to this really neat tool that's provided by Silvur. It's called Retirement Simplified. Now, it's important to understand that Silvur is not just an insurance not just in another insurance company, not just another, entity out there, because we all know that we're getting inundated with information with regard to Medicare, Social Security, retirement. We are provided to you because we are trusted by credit unions all over the nation. We work in multiple states, and each state is a little bit different. We are all licensed insurance professionals. So anyone that you meet with and answers questions, know that we are licensed. There is also no cost or obligation for any of the materials or resources that we talk about today. This is education that is provided to you courtesy of ELGA Credit Union. So just soak it all in and know that you're not going to have your phone blowing up or being sent a bunch of spam emails, and everyone just loves those, right? So we are also part of the Retirement Simplified team as well. And I want to show you that resource before we get going too far, because this is also something that you have at your disposal as an ELGA Credit Union member after our conversation today. Retirement Simplified is a tool that helps you specifically understand how Social Security and Medicare fit into your retirement financial puzzle. Okay. We take all the math and we distill it down for you. All you have to do is when you scan that QR code, you put some basic information in, your retirement age and when you plan to stop working, when you plan to take Social Security, what your income picture looks like, what your spending habits are and what they plan to be. And it will help you understand how these impact your retirement when it comes to Medicare, Social Security, and also where you live. Because, those of you who plan on spending some time in the warmer months or colder months somewhere warm, there we go, it can have a significant impact on your retirement picture as well. Once you put that information in there, not only does it help you from a math perspective, but it also helps with education. We've taken this, huge topic that, let's be honest, there are hundreds of books out there with, and all of them have their own ideas as far as, what should happen and when, but we take it and we break it down into very simple 3 to 5 minute lessons on topics that are important to you. We talk about estate planning, Medicare, and let's be honest, that's a very changing landscape. So we work very hard to make sure that that is up to date, almost, within a day or two of all the changes that happen. So it's always updating. We talk about Social Security. We talk about taxation and retirement, housing, the cost of living, inflation, and even more topics over and above that. That is something that you have access to as an ELGA Credit Union member. So just so you know about that. But today, really want to mention need, when do I need it, and before we go any further, I want to, Steph's going to put a little bit of a poll up here. And I want to ask this question because something that members always wonder is, why in the world does my credit union care about my health care? Well, my question to you is this. For an average couple that is retiring in 2025, how much do you think they're expected to spend on healthcare for the remainder of your life? There's a poll that just popped up, and I'd like you to take a second. I'm going to pause for about 5 seconds, and I want you to just take a guess. How much do you think that they're going to spend on their healthcare over the remainder of their life for a couple that's retiring in 2025? 100,000, 50,000, 400,000, 250,000, 750,000. What do you think? Okay. Still got a couple people putting those answers in. Okay, Steph, so what are the results?
Yes, just coming back in here. So it looks like our top vote is for 100,000. Next, the second highest guess is at 750,000, followed by 50,000, and then we've got a tie for 250,000 and 400,000.
Okay, so the answer is $416,000 is what the average retiring couple in 2025 is going to spend on healthcare over the remainder of their lives. $416,000. That's a really big number. And, that is why, your healthcare and we'll call it wealth care are very, very closely tied together in retirement. And this is why your credit union wants to make sure you understand how it affects the rest of your financial picture. Okay. Not only that, the way that kind of breaks down is just in premiums. The average couple in the United States will spend $9,676 in their healthcare premiums for a retiree today. Now, that does not include deductibles, copays, dental, vision, or hearing coverage. So the actual number, depending on how you use your plans, can be even more than that. So not only is it expensive, but it's getting more expensive as a part of your household budget. So, as far as Social Security over the past 30 years, it's gone up at 2.5%. However, Medicare Part B premiums have gone almost at twice that amount at 4.7%. Not only that, but Medicare does not cover long-term care. Someone turning 65 today has almost a 70% chance of requiring long-term care at some point in their lives. Right now in Michigan, the costs are close to $120,000 a year for long-term care. In some places, it's even more. So it's important that we have a plan in place for that. So because it's expensive, because there's a very high likelihood of everyone needing it, and we have to have a plan, we're going to talk about how do we navigate through this whole conversation, okay? So as far as Medicare eligibility, when am I eligible? Well, most Americans are eligible for Medicare the first day of the month when they turn 65, okay? Now, something that I'm always asked is, what if I'm still working? Do I have to enroll? Well, the answer is no. If you are still working, you have the ability to maintain coverage under your employer as long as that company has at least 20 employees, okay? And you'll have a choice. Either you can enroll in Medicare, or you can choose to keep your group coverage until you retire. Now, when you actually get ready to enroll, it'll be a little bit different depending on your specific situation. So for example, if you're already drawing Social Security, there's absolutely nothing you have to do in order to be able to enroll in Medicare benefits. You'll just go out to the mail one day and your red, white, and blue Cool Kids Club card will be right there waiting for you. However, most of the time, you actually need to go onto the Social Security website. Yes, you apply for Medicare benefits through Social Security, ssa.gov. That's the easiest way to do it. And you'll want to start the process about 90 days before you plan on enrolling. Now, it is important to remember that the age and timing when you enroll can affect your Medicare Part B premiums. And also, Part B and Part D are what are called means tested. That's a fancy way of saying the amounts that you pay for Medicare Part B and Medicare Part D are based on income. Okay. So not only that, but they have what's called a 2-year look back. So in 2025, the amount that you're going to pay for Medicare Part B is actually based on your income in 2023. Next year, if you plan on enrolling in 2026, it will be for Medicare 2024 will be the year that they'll use. And it's how they calculate that is based on your adjusted gross income as it's listed on your tax returns. That's why it's also we want to be very careful of increasing our modified adjusted gross income. And that's not just through working. Okay. If you were to do a Roth conversion, if you were to take money out of out of a traditional IRA to purchase a second home or to help a grandchild through college, something like that, that can affect the amount that you pay for Medicare Part B, as well as the time when you choose to take Social Security. So keep that in mind as we go. We'll get into that a little bit later. Now, as I mentioned, Part B and Part D are means tested. So it is affected by your income. Medicare can feel very overwhelming. That's why everybody's here today, right? It's composed of multiple components. Each one has different costs, different coverage. Some options, yes, there is a lifetime late enrollment penalty assessed if you don't sign up when you're first eligible. So it's really important that we understand the alphabet soup of Medicare, okay? There's 4 major letters: Part A, Part B, Part C, Part D, and then there's also things like Medicare supplements, dental, vision, and hearing coverage, and hospital indemnity as well. So what I'm going to do next is I'm going to explain to you what each one of these are and how they fit together. Medicare Part A and Medicare Part B together form what we call Original Medicare. Original Medicare is your red, white, and blue Cool Kids Club card. That's it. That's all. Medicare Part A addresses, they call it hospital. Okay. It's not just institutional health care, though. It's as far as a hospital stay in the traditional sense of the word. It also includes skilled nursing, home health care, and hospice. So think of Medicare Part A as 4 walls and bad jello. Okay. If you are in that type of a care setting, then it's being addressed under Medicare Part A. And guess what? There's no cost for Medicare Part A once you have enrolled. There's no premium involved because you've already paid it during your working years through your FICA taxes. Now, even though there's no premium for it, there is cost involved. For Medicare Part A, there is a deductible of $1,676 per occurrence. That means if you are hospitalized multiple times throughout the year and you only have Medicare Part A, that means that you can spend that $1,676 multiple times. I've seen it 3, 4, even 5 times in a year. So that's really important and why we don't usually have just Part A, okay? Now, Medicare Part B is a little bit different. Medicare Part B they call it medical. Think of Medicare Part B as anything that's the act of doctoring, okay? So any touching, poking, prodding, anything like that. So that would be doctor visits, lab tests, surgery, outpatient physical therapy, durable medical equipment, mental health care. And also what's not listed in here is prescription drugs that are given in a institutional doctor's setting. So that would include things like chemotherapy medications, an infusion, immunizations are in there, like your flu shots and things like that, as well as even allergy shots. Those are given in a doctor's office or in an infusion center or in a hospital. So those are addressed under Medicare Part B, not Medicare Part D. Now, the reason that matters is here, is the cost. Medicare costs are split up a few different ways. Now, most Americans pay $185 per month for Medicare Part B. Okay. It can be significantly higher, however, based on your income. We talked about that a few minutes ago. Now, for those of you who fall below certain income thresholds, we can also sometimes get you credits to help address those costs as well. But for most Americans, it's $185 per month. Now, in addition to that, there's a $257 deductible for Medicare Part B. Remember that number. We're going to talk about that again in a minute. And then after that, Medicare pays 80%, but that leaves an uncapped 20% that is your responsibility. So that means if you have a open heart surgery, it's $150,000, right? And that's a conservative number. So your portion, if you only had Medicare Part B, would be $30,000 plus hospital stay. If you had a chemotherapy regimen that we talked about, some of those drugs are very easily, $30,000 per infusion, and most infusions are required, every 3 weeks or so. That can get very, very expensive very quickly. Just as a just so you know, and I'm going to just pause for a second. This is actually a chart that shows how much your premiums will be based on income. So remember, there is that 2-year look back, but that's kind of where that falls. So you can kind of play with that. Now, original Medicare does not cover everything. We talked about some of those things already. We talked about that deductible for Part A. We talked about that uncapped 20% copay for Medicare Part B. And then there's some things we haven't touched on yet, things like prescription drugs, dental, vision, or hearing. Now, in order to be able to cover these things that original Medicare doesn't address, there are 3 different routes that we can take. And I'm going to talk about these first. So just to clarify, you have to get Medicare Part A and Part B first. And then we go a little bit into these other topics as well. Now, option 1, the Medicare supplement. Okay. Now, with a Medicare supplement, we need to get a separate prescription drug plan and then separate dental and vision. So think of this as an a la carte approach to healthcare. Okay. Medicare supplements, also known as Medigap, also, which is because they're intended to fill in the gaps of the things that original Medicare doesn't cover. They have a monthly premium. Okay. So here in Michigan, you will look at paying right now about $150 a month for a Medicare supplement plan. Now they do go up as you age. That's important to remember. But figure $150 for a Medicare supplement plan. If we do that, you'll have to get a prescription drug plan. Don't let that scare you. There's several in Michigan that are $10 to $20 a month, maybe even less. Okay. And then dental and vision will be about $50 or $60 a month for a good one, if you choose to enroll in dental and vision. Now, so that takes your whole cost to about $220 a month if you choose to do dental and vision on top of this. And you'd say, why in the world would I get a plan that costs me $150 a month? Well, there's a couple different reasons. Number one, with a Medicare supplement, there's no networks. So you can see any doctor in the United States that works with original Medicare, and you never have to worry about a pre-approval or whether or not they're in network or whether they accept your insurance. Every doctor and hospital system that works with original Medicare will take your plan. So you don't, for those of you who are snowbirds and want to spend significant time in Arizona or Florida or Georgia and want to be able to establish a doctor-patient relationship down there, this is a great option for you. The other thing is that with a Medicare supplement, you have to, as I mentioned, you have a monthly premium. You still have to pay that $257 on that Part B deductible that we talked about. But after that, you never get a bill in the mail for any healthcare that you have that's covered under Original Medicare. It's all paid for you. So if you just want to be able to know that if consistency is important to you and you want to be able to just pay your premium every month and not worry about whether I go to the doctor once or whether I go to 12 times or I need a whole bunch of tests or anything, supplements are a great option. They know exactly how much you're going to pay from month to month with regard to your health care without ever getting any bills in the mail. And it also, because it's not network based, it keeps the control of your care between you and your doctor, which is increasingly important in today's landscape. Now, with a Medicare supplement, as I mentioned, they do not include prescription drug coverage. So you have to get a separate prescription drug plan. Okay. If you don't, you will incur a late enrollment penalty for every month that you don't have coverage. So even if you're someone who says, I haven't taken a medication that was a prescription in the last 20 years, that's okay. There are plans here in Michigan that are 40 cents a month, okay, that satisfy that requirement. It is cheaper to get a prescription drug plan than it is to incur the late enrollment penalty, okay? So keep that in mind. So that's option one, monthly premium, need a separate prescription drug plan, but it covers everything, okay? No networks, great flexibility, knowing exactly what your budget's going to be for your healthcare every month. These are a great way to do that. Option two is Medicare Advantage, also known as C. Now, Medicare Advantage is very similar in function to employer group coverage, okay? There's two major types here in Michigan. There's HMOs or PPOs. So with a PPO, you can see a doctor in or out of network. You're going to pay more overall for your copays and responsibilities than you would with an HMO, okay? With most Medicare Advantage plans, they usually include prescription drug coverage right in the plan. So it's just like employer group coverage. You don't have to pay extra for prescription coverage. There's also usually other embedded benefits in the plan. So you might hear of things like Silvur sneakers. You might need dental and vision coverage. You might have heard about things like a over-the-counter benefit, where you can get a debit card that covers things that Original Medicare doesn't address, like vitamins and supplements, or over-the-counter pain relievers, or even some durable medical equipment, like braces and things like that. Those are all Medicare Advantage plans. Now, with most Medicare Advantage plans, there's a monthly premium. Some of them are even no cost. Okay. However, just like with employer coverage, you have costs and copays as you use the plan. So even though your primary care doctor might cost you nothing, if you have to see a specialist, it'll cost you $40 or $50 per visit. If you need to have an x-ray, it might cost you $35. But if you need to have a CT scan or an MRI, it might cost you $150 or even $300. If you have to spend the night in the hospital, you're looking at $350 to $400 per night for that hospital stay for the first week. So you will have costs depending on your utilization of the plan. Now, all of those costs do accumulate throughout the year until you hit what's called a maximum out-of-pocket ceiling. That is for a safeguard that's in place that says, if you have a really bad year, what is the most that I could be responsible for? Most plans here in Michigan, again, they're between $5,000 and $9,000, depending on which plan we put in. So unlike Medicare supplements, You pay as you use the plan with Advantage, okay? Until you hit that max out-of-pocket ceiling. That's why we offer option 3. This is where we take Medicare Advantage and we pair it with hospital indemnity. We'll call this sort of a hybrid option, okay? With option 3, this is a fairly new concept here in Michigan, but it's really kind of gives you the best of both worlds. As I mentioned, a Medicare supplement plan in Michigan, you're looking at, by the time you combine dental and vision and your prescription drug coverage along with your supplement plan, you're looking at about $220 a month. However, with this one, the cost is usually between 40 to 60, depending on how we structure it. Now, we still take Medicare Advantage plan. Okay, you'll enroll in Medicare Advantage, so you'll still have a network. However, the hospital indemnity plan will slide in behind it and pay for some of those higher dollar copays in the event of a significant health event. So it will cover those hospital stays. It'll cover ambulance. It'll cover surgeries. It'll cover, one that a lot of members don't think about is physical therapy. Physical therapy, it might only cost, $20 or $30 a visit, but let's be honest, we never go once or twice, right? The doctors will prescribe, 3 times a week for 6 weeks. And after a while, that can get very expensive. And more Medicare Advantage plans are requiring physical therapy prior to certain surgeries, especially when it comes to things related to joints and the like. So this gives you more predictability, because when those health events happen, it will pay those co-pays for you, and it still allows you to take advantage of the Medicare Advantage plan benefits. So you still get to keep those transportation benefits or over-the-counter benefits. You can still utilize the dental and vision plan benefits that you have. So this is something else to really consider as we're looking at our options through Medicare. Okay. So I've thrown a lot of information at you today. What do you do next? What do I do with it? Well, Retirement Simplified can really help you as you're deciding these things. So, you're doing the first step right here. You're being proactive, and you're really taking time to understand that the way that healthcare costs in your retirement are gonna impact you. So kudos to you for already doing the right thing. For more information, obviously, you can go to Retirement Simplified and clarify other things. Once you understand kind of what you want to do as far as a supplement versus Advantage, you have to start by applying for Medicare Parts A and B. You will start this process about 90 days prior to the first day of your birth month. And it's important that you remember that, because current processing times for Medicare are running between 90 and 120 days. So don't wait until the last minute to apply for A and B. Remember, that has to be processed and approved before you can either get a supplement with a drug plan or a Medicare Advantage plan. And then, you need to decide on a plan. Find a plan that fits your needs. The plan that's right for your neighbor or your aunt or your uncle, or, even a spouse, can be completely different than the one that's the best option for you. So make sure you understand what those different plans are, and enroll in the one that is the best for you. Okay. I do want to take some time now to answer questions. I know that we've covered a lot of real estate here during our conversation today. So I'm going to turn this back over to either Kevin or Steph, and give you guys the opportunity to ask me anything that you want to about Medicare. That's not a challenge.
Excellent. So let me see here. We've got one question here that I'm seeing. So the question says this, Jessie, it says, I have Blue Cross Blue Shield through my retirement pension plan. I am also getting my Social Security. Why do I have to join the Medicare plan?
Okay, so Blue Cross Blue Shield. I'm going to make a little bit of an assumption and assume that you have a retiree plan, maybe through the state of Michigan or through you to.
I'm going to jump in here. I don't know if this is occurring on your end, Kevin, but Jessie, it's breaking up a little bit if you can hear us. And if you can, Jessie, maybe if we try turning the camera off, that might bring the audio back. Thank you, everyone, for your patience. We'll see if we can get Jessie back in here in a couple seconds. If not, we'll keep moving forward here.
Absolutely. And please continue to submit your questions. We're going to line those up to make sure we can get you guys the information that you all need, because this is an excellent subject here by my summation. I mean, you know, Steph, when I'm thinking about, you know, what I have to do and how I have to prepare, and, you know, what kind of questions I'm going to have to answer, not just for myself, but for my parents, you know, as I support them, and also being an agent at the credit union, right? You know, this has really been very, very helpful to me in being able to point people in the right direction when they have questions around retirement. And I can't stress enough, for those of you that are on the webinar today, make sure you go out and visit elgacu.silvur, silvur.com, to make sure that you create a profile, right? You want to make sure that you're using this tool to help you navigate. You're going to be able to get a score. You're going to be able to identify maybe some of the areas that you need to improve on. So Jessie's back with us. I'll stop talking now.
So sorry.
She knows. Jessie, if you don't mind, I'm just going to reiterate the question real quick, just to give you kind of a moment. But the question was, it says, I have Blue Cross Blue Shield through my retirement pension plan. I am also getting my Social Security. Why do I have to join the Medicare plan?
Okay. So most Blue Cross Blue Shield plans in Michigan, when you become Medicare eligible, they will make you sign up for A and B. It's a way of them being able to shift some of that cost from the group plan over to the federal government. So yes, they will make you do that.
Excellent. Excellent. And then another question we have here is the supplement instead of an A or B, or in addition?
In addition. So you always have to get A and B before you can go any further. So then you can choose either a supplement where you pay a monthly premium in order to have the flexibility to see whatever provider you want and have, consistency with regard to your monthly premiums, or you can go Medicare Advantage and pay for services as you go.
Gotcha. And then another question we have here is, so this person is saying, I also have Blue Cross Blue Shield when I retire from the state as a part of my pension. So how does that help with all of this?
Okay, that's a good question. And because I'm in Michigan, I'm very familiar with that particular plan. Normally we try not to get too specific, but it's a pretty big plan here in Michigan. So the amount that you're going to pay for that premium for those is going to depend on your specific contract and your years of service. So sometimes there is actually cost for that plan once you move over into Medicare. You still will have to get A and B when you become eligible for that. Blue Cross Blue Shield will require it.
Awesome. And then we have, if I am still working past 65 and have employer health benefits, is there an advantage to register for Medicare and plans at 65?
So sometimes. So, and it depends on your specific situation. If you choose, you can. The easy default answer is you can keep your group coverage. There's nothing that says you have, and especially if you have a spouse that's under 65, or you still have children that are going through college or things like that, then sometimes it makes more sense to keep your group plan. However, quite often it's less expensive to move to Medicare than it is to keep group coverage. So we would be able to look at both options and find out which one's going to be the best for you. Now, if you do a lot of doctoring, it's important to not forget about a supplement plan. The only time when you are guaranteed the ability to enroll in a supplement plan is when you originally are eligible for Medicare. So if you have A and B and keep your employer retiree benefits, and then later on you decide that you're paying so much in copays because you are sick, or you do a lot of doctoring, you don't have the ability to leave that plan and enroll in a supplement plan without having to answer some health questions and pass a basic health screening. Okay, so that is something important to keep in mind.
Great information. This question says, you said to apply 90 days before 65. But it can take up to 90 days. Should I apply 120 days before?
You're not allowed to. Your initial enrollment period actually starts 90 days prior to your 65th birth month, runs through your birth month, and then 90 days after. So it's actually a 7-month window in total. You just want to make sure that you're on the earlier side of that window instead of the later side.
Okay. And can you keep group coverage and Medicare? This participant says that her husband will be 65 3 years before her.
So it depends on the company and the coverage. Okay. Some companies, especially if they're under 20 employees, you have to enroll in Medicare. But other than that, as long as they meet that threshold and have a credible plan, then yes, they absolutely can keep their group plan. Now, while we're talking about group plans, I do want to also just touch on one specific type of group plan, and that is those plans where you're contributing to a health savings account. If you are in a plan with an employer where you are contributing to a health savings account, you must stop contributions to that HSA 6 months before moving to Medicare. If you do not do that, you will lose a lot of the tax benefits that come along with that HSA. So if you're going to keep that employer plan and not move over to Medicare, or even if you are moving to Medicare from a plan that has an HSA, make sure you stop those contributions 6 months prior to moving to Medicare.
Awesome. And so do you have to sign up for an additional plan at the start of your Medicare enrollment, or can you get it later? And can you change it once you do?
Oh my goodness. Yes. So yes, you do not want to have just original Medicare. You will start to incur a late enrollment penalty, specifically with regard to drug coverage. Okay. So at the very barest minimum of minimums, make sure you at least have drug coverage in addition to A and B. Okay. Now remember, you have a pretty big exposure if you go that way. You're going to pay an uncapped 20% of all of your healthcare costs. So, if budget is a concern, at least get a Medicare Advantage plan that includes prescription drug coverage. If you stay healthy, you've got, you're not paying anything in monthly premiums. However, if you do have some kind of a catastrophic health event, that can just be absolutely devastating from a financial perspective very, very quickly. Okay. Now, when it comes to the ability to move around, that's where things get a little bit interesting. The only time you do not have to health qualify for a Medicare supplement is during your initial enrollment period. If you don't get a Medicare supplement straight out of the gate and you want one later, you can actually enroll in a supplement at any time. However, you have to be able to pass specific health questions. So you can't wait until you're really sick to apply for a Medicare supplement plan. Okay. They'll rate your coverage based on your health condition at that time, or they'll decline you entirely. Okay. Medicare Advantage is a little bit different. Medicare Advantage, you never have to answer any health questions. So, and you can change those and every year between October 15th and December 7th. That's why it actually is a good idea if you decide to do Medicare Advantage to actually have a review of your coverage options, excuse me, at least every 2 or 3 years, because your health changes, your doctoring changes, your prescriptions change, the plans themselves change, and you want to make sure that as your health continues to evolve and change, and the system continues to evolve and change, you're still in the plan that's the most cost effective for you and that actually meets the needs and the type of doctoring that you do.
Excellent answer there. This one says, you stated earlier that if you are receiving Social Security benefits, you don't have to do anything. We are automatically enrolled. Can you expound on that a bit?
Yeah, actually, the way that it works out is if you're drawing Social Security, they will look and they'll say, okay, this person is turning 65. They have worked the required number of quarters to qualify for Medicare. We're going to send their card out. That's literally all you have to do.
Gotcha.
Now, if for some reason you are covered under an employer or a spouse's employer or something like that, there will be on the back side of that card a line where you will sign it to decline that coverage and you'll mail it back to them. But if not, they will automatically enroll you in A and B if you're drawing Social Security benefits.
Got it. And what are the companies that offer the indemnity product?
There's several different ones. There's several different companies that offer these products, and I'd love to follow up with you on that specifically. And it's a fine line here because right now we're doing an educational presentation. Mm-hmm. If I start naming specific companies and premiums and all of those, it becomes sales. So for compliance, I want to make sure that we can actually disseminate this whole thing to you. So I'm so sorry. I hope you have my email address. I'd be happy to answer that for you privately. Okay.
Excellent. And then who do you talk to about the Medicare Advantage plans each year? And what is go ahead. Let's start there and then I'll give you the follow-up.
Okay, so here's the answer. I happen to be, do these educational events all over the United States. If you would like to look me up, I 100% would love to meet with you. Or you can find another trusted insurance professional to work with as well. There's so many of them. I highly recommend you don't try and navigate the system yourself. Because of the fact that it's so easy to make a mistake. You also don't want to just look at, just call like a specific carrier because they can only speak to what they offer, not whether or not it's the most appropriate for you or what other options there are out there. So if you are in this area and you want to look me up, I'd be more than happy to help you or find someone else who's a licensed, trusted, independent insurance advisor who can walk you through all your options, whether it's Advantage or supplements. Okay.
And then the follow-up to that question was, what is an HSA versus just a deferred cost plan from your paycheck?
Okay. So a health savings account is a specific type of account that some employers offer that allow you to put a certain dollar amount pre-tax into that savings account. Okay. That's different than what you're referring to. This is a very specific type of thing. So if you don't know what that is, you probably don't have one. Okay. It'll say HSA right on your documents. Okay.
And then do you have to decline your spouse's plan once you are Medicare eligible?
If you're currently on a spouse's plan and you want to enroll in your own Medicare plan instead, and it often makes sense to do so from a cost perspective, you will need to tell the employer. The employer won't just automatically disenroll you And if you were working with us, then I would absolutely walk you through that process. But our HR department is a little bit different. So you're going to want to connect with them on that.
Awesome. Okay.
Sure.
Quite a few questions there. Looks like we have come to the conclusion of those questions. So excellent information. Anything that you'd like to share further before we close out here?
No, actually, I think that we've done a really good job today of covering a plethora of scenarios. Steph has actually taken really good notes on all of those, and we'll make sure that everyone does get those answers, as well as a copy of today's webinar to reference in the future as well.
Absolutely. And I just somebody wants to make sure that your email gets put into the chat. So as long as we can get that in there. Other than that, it looks like people just saying thank you for your excellent information, saying that it is very informative. I absolutely love this. I want to remind our members that they can visit elgacu.silvur.com to access their free retirement score. And it is a helpful tool to see how long their money may last in retirement. I do want to thank you, Jessie, from Silvur, just for presenting and partnering with ELGA Credit Union as we stay committed to educating our members around retirement and really trying to make sure that people are much more prepared, that they feel more comfortable. But even as you talked about, and I love your heart for just serving and reaching out to people, because you're like, hey, put my email in there. I'd love to talk to you about these things. I really appreciate that partnership and just your commitment to making sure that people not only have the information, but they have a resource that will navigate them through some of these challenging thoughts and decisions that they have to make. And so I really thank you for being willing and giving up your time that way and being a resource to our members, because I know that we need it. And then finally, just thank our members, right? I think you guys that signed up, that jumped in the room, that are asking excellent questions. I am a firm believer that if you've got the question, somebody else had the question too. And so thank you for those of you that had the courage to jump out there and say, hey, what about this? And what about that? Because you gave us a diverse set of situations and scenarios that we can educate everyone else with. And so I am so glad to have the opportunity to be a part of this and to host this from the ELGA side for our members. And thank you, Silvur, for just partnering with us and being willing. I want to encourage you guys to just keep an eye out for details on any upcoming webinars as we continue to try and make sure you guys have the information that you're going to need as you venture into retirement. And so thank you so much, Jessie, and thank you, Silvur, right, for being our partner and helping our members.
Yeah, thank you for having us.
Our pleasure. Thank you so much, everyone. Goodbye.
Nice.